Hello, welcome to our frequently asked questions. Today I'm answering a very commonly asked question about lower blepharoplasty. Will I have a visible scar after lower blepharoplasty? Well, in answering this question, my approach is really to talk to you first of all about what are the changes that are commonly seen in the lower eyelid and what is required in order to improve those. Broadly speaking, lower blepharoplasty can be done in two ways. It can be done with an older technique that doesn't result in a scar in the lower eyelid, or a more modern technique where the scar can be hidden on the inside of the eyelid. I'll also talk to you about what can enhance healing, and if you do have a scar around the lower eyelids, what can be done to improve that further. So, as an introduction, my name is Dr. Julian De Silva. I'm a London-based facial cosmetic and plastic surgeon, and blepharoplasty is a common procedure that I complete for my patients on a daily basis. And a good proportion of the patients that I see have had surgery before, and I also complete revision eyelid surgery. So in terms of blepharoplasty, well, the common changes that one sees in the lower eyelid often involve like a swelling in the lower eyelid, or more than one swelling. And this is secondary to fat that everybody has that surrounds your eye and protects your eye, well, some of that fat creeping forward, resulting in a bulge in the lower eyelid. And although most of us consider changes in the eyelids related to aging, well, some of these changes are genetic as a result of what we've inherited from our parents. And I see many patients in their late teens or early 20s who have lower eyelid changes consistent with these genetics. So what can be done to improve this? Well, often requires either reshaping or movement of this lower eyelid fat. And the only way this can be achieved is by doing surgery directly to this orbital fat. Now, the older technique that involves lower blepharoplasty is sometimes called transcutaneous blepharoplasty. It involves a scar in the lower eyelid skin. And this scar, well, can be made more discreet by hiding it just beneath the lower eyelid lashes. However, when performing this technique, there can be a visible scar, and it can change the shape of the lower eyelid, which can be very difficult to correct. The more modern way of doing this surgery is doing the surgery on the inside of the eyelid that can hide the scar completely. And certainly this is my preference for over 90% of patients, because this will hide the scar completely. And in many patients, even a week after surgery, the lower eyelid can look markedly improved, because there's only a mild degree of swelling and often no bruising, which results in very fast healing without a scar. So in terms of the technique, well, the technique is of significant importance in defining whether you have a scar after lower blepharoplasty. And with a more modern technique, this scar can be truly avoided. Now, if you do have a scar in the lower eyelid, it does tend to improve with time over many months, but there are also measures that can be taken to enhance this healing. And two of these measures are in the use of bio oil that can reduce redness in the skin, and also the use of silicone gel when combined with gentle massage can improve the condition of the scar, making it smoother and less visible. So in summary, well, we've talked about lower blepharoplasty, we've talked about the changes occur and what is required with surgery, and we've talked about the two principal techniques and how a scar can be truly avoided. And certainly if you're considering lower eyelid surgery, I would discuss with your surgeon the technique that is used and whether a scar can be avoided completely. In addition to that, often other measures are required to give you the best possible result. And often I use a laser to tighten the skin after lower eyelid surgery, and sometimes that can be combined with fat transfer and the use of platelet-rich plasma in order to enhance recovery and give you the best possible result. I hope this information has been useful for you. Thank you for watching. If you would like further information about having blepharoplasty or eyelid surgery, please have a look at Dr. De Silva's book. This is a comprehensive patient guide with over 250 pages, including color illustrations and photographs, including all commonly asked questions and fears that patients have. This is available through either Dr. Julian De Silva's website or by searching on Amazon.